Yeah, come in.
Hello, how's it going?
Hi, going well.
Alright, my name's Kevin. I'm a graduate nursing student at UIC.
Okay.
What is your name?
My name's Alan.
Alan.
Yeah.
Calling you Alan's okay?
Yes, sir.
Okay. Alrighty. So, before we start, I just want to make sure you're familiar with advanced practice nurse roles. Do you have any questions on what that is? Or
Yeah, I'm
what that's
not quite sure exactly what that is.
Okay, so let's say, for example, we're talking about nurse practitioners here.
Yeah.
They have somewhat similar roles to physicians.
Yeah.
Depending on what kind of role in the hospital you are, you could work with the physicians or independently.
Yeah.
So you can see patients, you could assess them, you could diagnose them, and create a plan of care, and ultimately prescribe medications.
Okay, cool.
Okay.
Yeah.
Any additional questions on that?
No.
Okay, sweet. So again, I'm a nursing student at USC.
Sure.
So what my specific program entails is that I got a bachelor's degree in something else besides nursing. So for me, I got a bachelor's degree in kinesiology.
Okay.
I was going to go into physical therapy, but I had to change the course there.
Okay.
So this is where I'm at now. So after I graduate, I will have a RN. I will work towards having a RN after I take the boards.
Sure.
But I'm on a path for further advancement if I so choose to. So towards a nurse practitioner or advanced practice nurse.
Sure.
Okay?
Yeah, let's go.
Cool. Okay, just want to verify some more information, just to make sure we have everything down.
Yeah.
Can you tell me your full name, please?
Allen City.
Allen City, cool. And your birthday?
10/29/93.
Okay. And your address?
1428 East Lillian Avenue,
Lillian Avenue.
Arlington Heights, Illinois 60004.
Perfect. Your phone number?
847-769-5692.
Okay. Alrighty. And how old are you?
I'm 23 years old.
And do you identify, what gender do you identify with?
As a male.
As a male, okay. And race?
I'm Indian.
Indian, okay. Alrighty. And your usual source of healthcare? Or who do you go see when you get sick? Or
I'm a primary care physician.
Okay.
Yeah.
Okay. A couple other questions. Your marital status as of right now?
I'm single.
Okay.
Yeah.
And your present occupation?
I'm currently a student as well.
Okay.
I am actually a nursing student at UIC.
Oh, perfect.
Yeah.
I went there too. Great school.
Yeah, nice. I also work as a PCT at a hospital nearby.
What kind of unit?
I'm actually registry, so we're in the Navy, essentially.
You getting good experience?
Yeah, absolutely. Yeah, it's a great
Types of units?
experience, yeah.
Okay. So what brings you in today?
I'm here for my annual checkup.
Okay, sweet. Overall, how do you feel health-wise? Any complaints of illnesses or any aches or anything you want to let me know about from the get-go?
Pretty healthy.
Okay.
Yeah.
What was the date of your last examination?
September 20. Yeah, September. Last September. Yeah.
Last September.
Yep.
Okay. And what was the reason for that last visit?
Same annual checkup.
Annual check.
Yeah.
Okay. Anything changed from the last checkup? You feel?
I feel pretty healthy. Yeah.
Okay. Good. Okay. Any significant past or current illnesses or anything like that you want to let me know about? Okay. Pretty healthy, huh?
Yeah.
And your health and well-being in general still pretty good?
Yeah, it's pretty good.
Okay. Pretty easy. All right. I just want to talk more about your past medical history, more details.
Sure.
Immunizations, are you all up to date? Did you get all your vaccinations
I'm
as a kid?
Yeah.
All right, good. Okay, allergies. Any allergies to food?
No.
Medications including penicillin?
Nope.
Latex?
No.
Environmental? Any pollen, dust, mold?
No.
Okay. Okay. Any past hospitalizations? Any surgeries? Any type of hospital stay?
No.
None at all?
Not at all.
Lucky guy. Oh, okay. No surgeries as well?
No surgeries.
No emergency department visits?
No.
Anything like that?
No.
Okay.
I'm pretty fortunate, I'd say.
Yeah. Any injuries that might not have required a hospital visit, would you say?
It's not like your normal like falling and going
Yeah.
foot and scrapes. Nothing.
No?
Nothing.
Okay.
Yeah.
No knee sprains or shoulder
No.
sprains? Nothing? Okay. Medications, things you take on a daily basis or as needed, any vitamins, herbal supplements.
I mean, I occasionally take like a Tylenol here and there, but
Yeah.
that's about it.
What would you take those Tylenols?
If I had like a headache,
Okay.
yeah, but that's like, that rarely ever happens.
That rarely
Yeah.
happens. Okay. And do you seek any alternative therapies like acupuncture, massage therapies, anything like that?
No.
Okay. Okay. Now we're gonna go over family history. Okay.
Mm-hmm.
Starting off with a basic question: does your family history contain anything regarding diabetes, heart disease, any cancer, anything significant that's common throughout your history?
Yeah, I feel like diabetes and high blood pressure are significant
Okay.
in my family history, yeah.
Okay. Where along that family tree? Is it more your mom or dad's side, or?
I've been both.
Okay.
My mom herself has diabetes, so does
Okay.
her mom and a few of her siblings. And then on my dad's side, a few of them have diabetes and blood pressure.
High blood pressure?
High blood pressure, yeah.
Who on your dad's side? Is it just a good mix?
It's a mix, yeah.
Okay.
My parents both have a lot of siblings, so it's kind of hard to track who has what.
Okay. And are grandparents from both sides, are they both living right now?
My grandpa from my dad's side is deceased, but the other three are still alive.
The dad from your dad's side, you said?
Yeah.
Okay. Okay. And do you know roughly what ages? What age did your grandfather on your dad's side pass? Do you know?
He was 85.
85. Okay. And your other three grandparents, roughly how old are
They're all in their low 90s.
Low 90s. Okay.
Yeah.
Okay. And your parents? Any health problems with them? Any cancer?
My mom is diabetic.
Your mom's diabetic,
Yeah,
right?
that's about it.
Okay. And what ages are they?
They are mid.
Don't even know your parents' birthdays.
I think my dad is 54 and my mom is 52.
Okay. And no other health problems, you said?
Yeah, I know they're
Okay.
close, yeah.
Brothers and sisters for your mom and dad?
For my mom and dad?
Yeah.
My mom has 2 brothers and 6 sisters,
Oh, wow.
and then my dad has 3 sisters and 5 brothers, or 4 brothers.
4 brothers.
Yeah.
And any significant health problems with them?
No, so the diabetes.
Just the
and
diabetes and
high
high blood pressure that you
Yeah.
mentioned? And rough age range for all of them? Are they all generally?
Yeah, they're all between anywhere from the 70s to their 40s. Yeah, 40s to 70s.
And are they all living right now?
They're my mom's oldest sister passed away. I think she was in her 50s.
50s. Do you know what she passed from?
I'm not sure.
You're not sure?
No.
Okay. But was it from an illness or an
No, it was not
accident?
Nelson. It was yeah, I think it was just I don't know if it's a natural cause. No one really saw it coming.
Mm.
Yeah.
Let's see. Any siblings?
Oh yeah, I have a brother, a younger brother.
I've always wanted a brother. Yeah, I have a sister at home, or she was at home. I wasn't very fond of her. But how old is your brother?
He's 18.
18.
Yeah.
And any health problems with him?
No.
Pretty healthy guy.
Pretty healthy.
Okay. Let's see. Okay, so I'm just gonna ask these common health problems that might occur within a family tree.
Mm-hmm.
So I'm going to ask you if any of these are present within your family tree,
Sure.
family history.
Sure.
Okay. So real quickly, I know you said no allergies for yourself, but for anyone in your family, is there a trend of allergies?
No.
Okay. Asthma?
No.
Okay. High blood pressure, you said yes.
Yeah.
Heart disease?
No, instead of the blood pressure, no.
Okay. Stroke?
No.
All right. You said yes to diabetes. Cancer? You said no to that, right? Thyroid disease?
No.
Any blood disorders? Any clotting disorders? Anything like that? Obesity?
No.
Vision, hearing problems besides
But
glasses?
No, I don't believe it was glasses.
No?
No.
Nobody else? Okay.
Yeah.
Any genetic or congenital diseases or any birth defects? Anything along those lines?
No, not that I'm aware of.
Okay. Neurological problems, including seizure, emotional problems, mental illness, any cognitive disorders?
No.
Okay. Any behavior issues?
No.
Any drug or alcohol abuse?
No.
Okay. So are you, at this point in time, are you concerned with any health problems that might be passed down to you from your family history regarding the diabetes and the high blood pressure?
I'm concerned about diabetes. I just don't want to get it, so
Right.
I just watch my intake and all that. But nothing,
Right.
not a serious concern, I'd say.
Okay. So you say you watch your intake?
Yeah, my sugar
in terms of
intake.
your sugar intake?
Yeah,
Okay.
yeah.
Do you feel like you do a pretty good job?
I try.
You try.
Not every day, but you know.
Okay. Do you check your blood sugar at all?
No, I've not.
Okay. Okay. And for your blood pressures, do you check them regularly, or have you had any high or low values?
No, it's usually been around the 120 to 80 range.
That's good. That's within normal range. Okay.
Yeah.
Okay. So moving on to more personal and social history,
Sure.
just to see what your environment is like. So what is your living situation? What is your living situation like right now? Where do you live? Who do you live with?
I currently live at home
Okay.
with my parents.
Okay. Both your parents?
Both my parents.
Okay.
Yeah.
Do you live with your brother at all right now?
No, my brother's actually in college.
Brother in college. Okay.
Yeah.
Cool. Where does he go to school?
Yeah, he goes to DePaul.
Not as good as USC, but
Yeah.
not everyone can be as good. Okay. Let's see. Occupational history. What kind of environments have you been working in your adult life here?
A variety of different environments, but mainly pertaining to the hospital.
Hospitals? Okay.
Yeah.
Any hazards? Any chemical hazards? Health hazards?
I'd say like the normal bacterial infections and all that
Yeah.
you see at the hospital. Nothing different.
Good. Are you pretty good with following the protocols?
Oh, absolutely.
Alright,
Absolutely.
that's
I
good.
try to wash my hands at least once every half hour.
Good.
So yeah.
Hand hygiene is something people need to work on. these
Yeah.
days, Okay. So, financially, do you have any financial stress at home? Are all your basic necessities being met at home?
Yeah.
Okay. Educational level? How many years of schooling have you done so far?
So I did my bachelor's down at U of I. So I have that, and then I've been doing my master's for the past. This is my third year, so
Third year? Okay.
yeah,
So a lot of schooling.
it's a lot of schooling. Yeah.
Okay. And have you been pretty successful at school? Have you had any difficulties with grades or just concentrating in general, or?
No. I've been to this far, so I'm assuming I'm doing all right.
Right on. Okay. Okay. And any special interests you've had during school? Any different hobbies or clubs you've done?
Not necessarily. I've been part of a few faith-based groups, but that's
Okay.
about it.
Okay. Alrighty. So on to habits here. Any current or past use of tobacco or any smoking of any kind?
No.
Very good. Any use of alcohol?
Yeah, I drink alcohol.
Okay.
Yeah.
How often? How many drinks per week would you say?
I would say probably like 7 to 10 drinks per week.
7 to 10. Okay.
Yeah.
And is that more of a social thing, or is it
Yeah,
more of
man,
drinking alone?
No, I usually social, and then from time to time I'll have like a beer at home.
Alright.
Yeah.
Just like a nice nightcap, right?
Yeah, exactly.
Alright.
After a long day, just
I
a
know what you mean. Yeah.
nice cold one.
Okay. Caffeine usage? Any coffee or energy drinks or any caffeine pills? Anything like that?
I mainly just drink coffee.
Coffee?
Yeah,
How much coffee would you say?
I would. Probably
Like how many times? How many
2 or
cups?
3 cups per day.
2 or 3 cups per day?
Yeah.
Looks like you need a cup of coffee right
That's
now.
all the time.
Okay. Any use of recreational drugs, street drugs,
No.
anything like that?
No.
Okay, good. Sleep patterns? Do you feel like you're sleeping well at night? Do you feel well rested when you get up? in the
Yeah,
morning?
yeah.
Okay.
Yeah. Depending on the day, I might not get to sleep as much, but when I do sleep, I sleep pretty well.
How many hours per night would you say on average?
It's anywhere from like 4 to 8. It varies on just the day.
Do you feel like do you wake up in the middle of the night? Do you get
No.
disturbed?
No,
It's
I'm
pretty-
sleep all the way through.
Pretty smooth? Okay. Exercise. What's your exercise looking like? these
Currently
days?
don't really. It's very infrequent.
It's important to do.
It really is.
Yeah.
I'm so lazy.
Yeah.
Yeah.
So how many times per week, or how many times per month? How many times per year?
Probably say like 2 to 3 times like a month. Yeah.
Okay. And what kind of exercise would you say it is? What kind of activities do you
I
do?
usually just play basketball.
Basketball?
Yeah.
Okay. You any good?
It used to be, and then I
Yeah.
got fat, so.
Don't say that. Okay. Regarding diet's pretty important, right?
Yeah.
I just want to get a snapshot of what you're taking in terms of food and liquids.
Sure.
So if you just want to give me a quick recap of what you've eaten past 24 hours.
Sure. So yesterday for breakfast, I had oatmeal.
Good.
And then I had some pizza for lunch.
Pizza for lunch?
Yep. And then I had some masticholi with some sausage and peppers for dinner.
Ooh.
Yeah, it was really good.
Yeah.
And then afterwards I had some duck and had some gelato with that.
Man, you're eating good.
Yeah, I mean, it tastes good. I don't know about I don't know everything else.
So you didn't really talk about your liquid intake. What kind of beverages are you drinking, and how much water would you say?
So coffee and water for,
Coffee and water,
for
okay.
the most part. I would say, yeah, like 2 or 3 cups of coffee and then like 5 cups of water a day.
Okay. How many times would you say you eat up compared to making food at home?
Oh, I definitely eat out way more than I make food.
Okay.
I eat out at least once a day.
Once a day?
Yeah.
So what, 7 times a week?
Yeah.
Okay.
I definitely say 7 times a week.
Okay. Let's see. Alright, so stress is a big part of the society,
Yeah.
especially as a young student, young man. Do you feel like you encounter a lot of stress at this point in time in your life?
Not a lot, just like the usual stress related
Yeah.
to school and all that.
Okay.
Yeah.
And when life does get stressful, do you have outlets to relieve that stress? Or
Yeah.
cope with stress?
So yeah, I tend to just either eat my stress away or just
Yeah.
or like sit back, like watch a couple movies or go on YouTube.
Okay. And do you have a lot of family and friends as a
Yeah,
support system
yeah,
around you?
yes, yeah.
Okay,
I
good.
make sure to take time away from school to hang out with friends
Okay.
whenever I can.
And have you had any problems with stress to the point where it's really affecting your life and you need to seek help, or has it been manageable? Okay.
It's been manageable.
Okay. Something we ask everyone just to make sure everyone's safe. Have you had any exposure to any violence or abuse to you yourself or people close to you?
No, not that
that
I
you want to
remember.
talk about? Okay. Let's see. Safety. Ideally, everyone's practicing, good safety measures. Is that something you do? Like, you wear your seatbelts, you wear a helmet when you ride your bike.
Mhm.
You're not texting and driving. That's a big thing these days,
Yeah.
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 Okay, good. Okay. And smoke alarms, carbon monoxide.
Yeah, they're all
They're all up to date.
Yeah.
They're all working.
I hate when it makes that beeping sound, so I
Yeah.
make sure I'm on it all the time.
You're changing your batteries.
Absolutely.
Okay, good. All right. So current or past exposure to health hazards. So maybe something in your home, if there's a lot of gas or something, or at work, you're not following those protocols.
Mhm.
But you mentioned you were pretty good about that.
Yeah, pretty good about
You
protocols.
feel like you're exposed to any health hazards?
I'm not from aware of now.
Okay.
Yeah.
Okay. And your source of water is okay?
Yeah.
I don't know where you obtain your water from at home.
Yeah, I actually live in the suburbs, so we
Yeah.
use the tap water.
Tap water?
That's perfectly fine. Yeah.
Okay, sounds good. And religion? Do you have a religious affiliation?
Yeah, I'm Catholic.
You're Catholic?
Yeah.
Okay. And to what extent do you practice? Do you practice pretty frequently?
Yeah, perfectly. Yeah, I go to church on Sundays.
On Sundays?
Yeah, I'm pretty involved in my church outside of that too.
Okay, nice.
Yeah.
What do you do within your church?
I help out with the youth group.
Okay.
Yeah.
Awesome.
Yeah.
Doing good things.
Hopefully, man.
Okay. Okay, Alan. So I just want to quickly go over the major body systems and just make sure I'm checking out everything and questioning what I need to get a complete picture of your health here. Okay. So just starting off, recently have any fever, chills, malaise, like a state of tiredness, I would say.
Mhm.
Night sweats, any fluctuations in weight?
No.
No? Okay. Have you been in any type of pain anywhere in your body recently?
No.
Okay. So your skin, any random unexpected cuts or abrasions or any moles?
No. Not that I know. Yeah.
When you're out in the sun, do you protect your skin with sunscreen or anything like that?
I pretty bad about
Yeah.
sunscreen. Well, if I'm out in sun for like a long time.
Yeah.
Long time being like 8 hours. If it's something less than that, I typically don't.
That's a long time. Make sure when you're out for a couple hours, you want to apply something,
Yeah.
okay, protect your skin. And your nails are okay? They're not becoming brittle or breaking easily?
No,
or
no, they're
any
good.
cracks? Okay.
Yeah.
Hair-wise, for your scalp, is there any like peeling or anything like that, or is your hair getting thinner?
No, yeah,
Any unexpected changes?
I would say like my hair is kind of thin, but my scalp is fine.
Yeah. Hair thinning, is that something that happens in your family?
Yeah.
Yeah.
It's pretty common for all of us. So yeah.
Okay. So eyes, I see you have glasses on.
Yeah.
When did you start wearing glasses?
It's been about 10 years.
10 years? Okay.
Yeah.
Alright. And when was the last time you had an eye exam?
It was actually last summer, so I want to say August.
Okay.
Yeah, in August.
Okay. Alright. And you had no issues or have had glaucoma or cataracts or anything
No.
of that nature? Okay. Hearing? Any issues with hearing loss or pain in your ears?
No.
Any discharge, vertigo, anything like that?
No.
Regarding your nose, any frequent colds or runny noses or random nosebleeds that are unexpected?
No.
Okay. So, teeth brushing and flossing. How often do you brush your teeth?
Brush my teeth like twice a day.
Twice a day?
Yeah.
Okay. And are you currently flossing?
I do not floss. Yeah. It hurts a lot when I should doing it, so I just stopped
Yeah.
doing it.
It's important, you know?
Alright, yeah.
And any issues with your teeth or your tongue? Any problems swallowing, anything
No.
like that? Okay. Good. Your neck? Any issues with stiffness, pain, tenderness?
No. Nothing out of the ordinary.
Swelling?
Yeah.
Nothing? Okay.
Yeah.
This might seem strange, but I want to ask about your breasts. Any pain or tenderness? Anything like that?
No.
Yeah. some people think that's a problem specific to women, but it does happen to men as well.
Mhm.
That's why I asked.
Yeah.
So you said no cough. Any history of coughing recently?
No.
Coughing?
No.
Any shortness of breath? History of asthma?
No.
No.
Nothing.
No phlegm production or anything like that?
No.
That's out of the ordinary?
Yeah, nothing out of the ordinary.
Okay. Any chest pain, high blood pressure, heart murmurs, cholesterol?
I think it's been good so far, yeah.
Any episodes of just your heart beating really fast?
No.
Out of the ordinary? Okay. Any problems with digestions in general or with certain types of food?
Nothing for the most part. If I have like too much milk in the morning,
Yeah.
then I'll have to like go to the bathroom afterwards. But
Okay.
outside of that, no really problems with that.
Okay. Bowel movements have been regular?
Yeah, regular.
Yeah.
Like once a day.
Once a day?
Regular, yeah.
Okay. And the good consistency is not too loose or not too...
No, yeah, it's
Not too hard? Okay,
Yeah.
good. And no nausea, vomiting?
No.
Okay. You're looking pretty healthy here, I must say. What problems? Any problems with urinating? With like varying frequencies or discomfort, or pain, any discharge?
No, everything's been fine.
No. Okay. Are you circumcised?
I am.
Any issues with any sexually transmitted diseases or anything like that?
No.
Okay. Do you have any history of infertility, or are you trying to have kids right now? Or
No, absolutely not.
it's too young, right?
Yeah, way too.
Yeah. Have you had any prostate exams?
No.
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 Okay. So prostate issues can arise as you get older.
Mhm.
You might want to start looking into it. You want to start getting prostate exams in your 30s. That's what they recommend, okay? So
Okay.
just keep that in mind. I know it can be a scary thing. I thought it was a scary thing too. But physicians make it very easy and they make it comfortable.
Yeah.
It's rather quick. And if you catch these things earlier on, it's easier to, get to a solution.
Mhm.
Okay, sexual history. What is your sexual orientation?
Heterosexual?
Heterosexual?
Yeah.
Okay. And are you currently sexually active?
I'm not.
You're not? Okay. Okay. Any issues with your extremities or any body movements? Is your range of motion okay?
Yeah, everything's good.
Moving your arms around, your
Mhm.
knees, your ankles,
Yeah.
and your shoulders?
Yeah, everything's fine,
okay?
yeah.
Okay. No stiffness or anything while you're stationary or while you're walking?
No, yeah.
Okay. Any histories of head injuries, loss of consciousness, any dizziness, any memory issues, mood swings,
No.
seizures? Nothing of that
No,
nature?
No.
Okay. Any blood issues? So anemia, bleeding issues. Have you had blood transfusions before?
No.
No?
No.
And any issues adjusting to temperatures or anything like that?
No.
Okay. Mental status. So, do you have any issues with, mood? Have you anxiety, panic disorders?
No.
Any,
None of that.
have you any suicidal ideations or anything like that?
No.
You feel like your mind's in a pretty good place?
Yeah, I would say so, yeah.
That's good. Okay. So as far as the history portion goes, I think that's all there is. Do you have any questions for me at this point in time?
No, I'm good.
Okay, cool. All right, thank you so much.
Yeah, absolutely.